Thank you for exploring our series of short videos intended to provide practical information on oral health. These videos were developed with caregivers in mind, whether you're looking after a loved one at home or a professional working in a care facility. These videos provide tips on oral care practices and include information on a range of oral health conditions. Please keep in mind that it takes many years of study to become a dentist. We are sharing some of the knowledge we gained in dental school and over our years of caring for patients. Hello, I am Dr. Patrice Smith. Today, I'd like to speak on signs and symptoms of oral problems. In order for us to know what to look for, we do have to know what a healthy mouth looks like. Here are some characteristics of a healthy mouth. Our gums should be moist, pink, and firm. The tongue should be clean and pink. There should be no bleeding upon flossing or brushing. The breath should be neutral or pleasant. The teeth should be white and strong. There should be no sensitivity of the teeth. There should be proper spacing between the teeth and proper jaw alignment. Additionally, you should have a proper bite. These are images of what a healthy mouth looks like. If you look closely, you'll see white aligned teeth, pink firm gums, jaw alignment, and proper bite. Here are some common oral problems in the elderly. Gum disease, such as gingivitis or periodontitis. Tooth decay is very common. Dry mouth or xerostomia, and certain oral cancers. Let's look at what unhealthy teeth and tissues look like. You want to look out for gingival recession. That is when the gums have receded and the teeth appear long. In gingivitis, the gums will appear puffy and red. With tooth decay, you may see color changes of the teeth and even some notching. In periodontal disease, this is an enhanced version of gingivitis where you'll see tartar buildup and you'll see inflamed gums, red gingiva. Dry mouth may present as a red, bald tongue. Fungal infections are common diseases and conditions of the oral cavity. Some causes of fungal infections include antibiotics, corticosteroids, chemotherapy, immunodeficiency, ill-fitted dentures or unclean dentures. So in this case, you want to make sure that you clean the dentures thoroughly. Some dry mouth medication can also lead to fungal infections. Some of these fungal infections include thrush, or otherwise known as acute pseudomembranous candidiasis. This will appear as white patches on the roof of the mouth, on the cheeks, on the tongue, or on the gingiva. In addition to that, you can have angular cheilitis. This presents as sores or cracks in the corners of the mouth. If they are denture wearers, you want to watch out for denture stomatitis. That is redness or soreness underneath the dentures. Some symptoms of fungal infections, once again, includes white patches on the cheeks, tongue, roof of the mouth, or throat, redness or soreness, cotton-like feeling in the mouth. It may present with a loss of taste. Sometimes there may be pain while eating, and sometimes there may be cracking or redness of the corners of the mouth. Herpetic lesions can appear on the tongue, inside the lips and cheeks, and even on the corners of the mouth. What causes herpetic lesions? The herpes simplex virus lays dormant within the neurons and is activated by stress or immunosuppression. The symptoms, like I mentioned before, includes blisters that are on the tongue, the corners of the lips, or inside the lips and cheeks. How do we care for herpetic lesions? We can use antiviral oral medications like acyclovir, famciclovir, or valacyclovir. We can apply antiviral topical ointments, or we can use an over-the-counter topical anesthetic or an anti-inflammatory agent to alleviate the symptoms. Aphthous ulcers are also very common. These present themselves as little sores that are on the insides of the lips and cheeks or on the corners of the mouth. Aphthous ulcers are caused by stress, vitamin C deficiency, or an autoimmune issue. The symptoms present themselves as canker sores under the tongue, inside the cheeks, and sometimes even on the corner of the lips. Trauma to the oral cavity is very, very common. Some of this trauma could be biting of the lips and cheeks, or even a broken tooth. The symptoms of some of this trauma include swelling, soreness on the area of the tongue or cheek, or a red or sore spot on the roof of the mouth. Another condition of the oral cavity include oral cancer. This one you must pay attention to. They can present themselves underneath the tongue, on the gums, on the tongue, and even on the roof of the mouth. You must be aware of any unusual swelling, discoloration, or any bumps on the gums when you're caring for the elderly. Whenever you see any unusual changes, you must consult your dentist or a physician to have this checked out. Some of the very common causes of oral cancer include smoking, heavy alcohol use, chewing or spitting tobacco, and the symptoms can be very painful. Watch out for any swelling or pain that does not go away within 2 to 3 weeks. It will present as either red, white, or a mix of both. Abscesses are also very common, and these are usually associated with tooth decay or a broken tooth. Examine the mouth very carefully and watch out for any bumps on the gums. Abscesses are caused by root canal problems, broken or fractured teeth, tooth decay, and some of the symptoms can be swelling, pain, a bad taste in the mouth, or a pimple on the gums. Another condition is a burning sore tongue. Whenever you examine the mouth, you also want to take the tongue into consideration. The tongue should be firm and pink. If the tongue is bald or strawberry-like or very red or inflamed, you must consult your dentist to have a checkup. What causes this soreness of the tongue or this burning tongue? Sometimes it can be a deficiency in vitamin A or even a fungal infection. Thank you for watching this video. I hope this was helpful in helping you to identify some signs and symptoms of oral care problems.